Welcome to Holistic Health Heroes, here to help you become your own health advocate and introduce you to some heroes in the holistic health arena. Let's get started. Finding a dentist these days is probably one of the most important tasks you can take on, but not all dentists are created equal. There are accepted standards of dentistry, and then there are those who go above and beyond to ensure they are using materials that are more compatible with your body. There are those dentists that understand the systemic impact of dental treatments, and that's why today I'm introducing you to my holistic dentist, Dr. John Light. Join us and gain some insight on how important dentistry is to your overall health. Welcome to Holistic Health Heroes, here to help you become your own health advocate and introduce you to some heroes in the holistic health arena. Let's get started. Good morning, Dr. Light.
Good morning, Carrie.
So nice to see you here.
Thank you. It's nice to see you too.
Thanks so much for being here and doing this. I know with your busy schedule, you've got, like you said, an emergency to get to later, but I'm super excited to share with my audience the things that they should know about their dental health, because in my experience and with friends and family that I talk to, people feel really disconnected with that. They're not making those connections between your oral microbiome, let's say, and the rest of your body. So that's what I hope we can amplify a little bit today. But before we get into all that, maybe you could just introduce yourself and tell people about your long career, your various expertise. Just let us know who you are.
Thanks, Carrie. Nothing in life is like a straight line.
So true.
So I started, I wasn't a really good high school student. I got my dad said, we grew up in a steel mill town, Johnstown, Pennsylvania. It's east of Pittsburgh. And my career path was going to be working in the mill because that's what everybody did.
Oh, wow. I didn't know that.
So I went to, my dad wanted me to get a job. And so I went to, I got the easiest job I could find that was taking money for a junior varsity basketball game. And the faculty advisor was an English teacher. And I worked with him my junior year, and he said to me, he said, why don't you take my college English course? And I said, Mr. Slick, I said, why would I do that? I'm going to the mill. And he said, well, go ask your dad, maybe you should do it. So I did it, and I went to college at West Virginia University, and I'm the first person in my family that graduated from college. And then I taught school for 4 years in a middle school in Pittsburgh. And then I got my master's degree in health and safety. And I worked for the Atomic Energy Commission, as it was called at that time, under Admiral Rickover, the not inventor, but the proponent of the nuclear submarines. And then I decided to go to dental school. And so I graduated from dental school. I went to the University of Florida for a residency. And then I was very fortunate to get into a practice in Coral Gables where I learned a lot about dentistry. And I practiced there for about 15 years. And then I bought a practice up in Lake Worth, Florida. And it was a holistic practice. And honestly, I knew nothing about it.
Wow.
So for the last 24 years, I've just been a perpetual student trying to learn the connection between oral health and systemic health.
Well, then you're the perfect person to teach us.
Well, let's see.
So that's so interesting that of course, you're going to find your way into traditional dentistry because that was not, there wasn't such a thing as holistic or biological dentistry.
Correct.
But then you found your way to it through another practitioner, or was it just a sale of a business, or how did that kind of happen?
Yeah, it was just, I had looked around because I was moving, I had a young son, and Miami was going through a rough time, and I wanted him to have a more normal life, if there is such a thing, and there probably isn't, but so we moved up to Boca Raton, and I commuted down to Coral Gables for about 5 years. And then it got to be too much, and so then we looked around for a practice, and there was a practice for sale that I purchased, and I really honestly didn't know what I was getting into.
And the path unfolded in front of you.
Exactly.
So since you've had that path, how would you describe for the people who maybe have never heard of this holistic version of dentistry, what's the difference between traditional and biological or holistic dentistry?
So, I mean, I think that's an important question. And I would first say, for all the holistic practitioners, they still have to be really good dentists. I mean, they should be really good dentists. The difference is the connection between oral and systemic health. And noticing that there is a connection between what goes on in the mouth and the rest of the body. And as we can talk later about what some of those things are. And you just have to open up your mind to what's possible. And then experience teaches you what happens when you work on patients and you take out mercury fillings, or if you do a test to find out what their oral microbe is.
Yes.
And then you learn and you see the improvements in their health or not, depending on their genetics and so forth.
Right. And of course, this is a deeply personal topic
Yes.
for me because my mom has had a lot of dental problems. And, just for the record, I guess I want to say that started from when she was in a car accident very young. So some of these things, happen outside of our control with our teeth, whether
Correct.
we have an accident, whatever it is.
Correct.
Because I've told this story in bits and pieces to people I meet along the path and along my own way, and they'll say, "Oh, well, dental hygiene is really important." It's like, "Oh, no, you have no idea." Like the lengths my mom goes to and always really has for her hygiene. But when you have an accident of an impact, something affects your teeth, that could be the start of something that starts to go very wrong with your health. So I wonder if you could kind of highlight that. I'm diving right into it now.
That's okay.
Of how does that look for some of your patients that you've seen?
So I'm not sure the question. Does that mean, have I seen with removal of root canals or cavitations or any of that stuff?
Yeah, sort of. So to just parallel my own, witness of experience where someone will have a lot of dental work done and they will have various types of impacts on their health, and they're wondering what's going on here, and they don't know. Right. It could relate to their teeth.
Right. Well, I think that's so. There's the interesting part is that when I was going through my journey, there was nobody has ever talked about the oral systemic connection, and now even allopathic dentistry or medicine, now that everybody's making that connection.
Interesting.
So now we know that we have to look at the mouth differently. Not just, hey, what crown can I do? What bridge can I do? What root canal can I do? Or how is that going to impact them? What is their health concerns at this point? Do they have inflammatory issues? Because all of medicine now is talking about every disease, diabetes, coronary artery disease, dementia, on and on, as inflammatory diseases. And dentists really see those inflammatory diseases first in the mouth, because we see bleeding gums, we see swollen gums, we see periodontal disease. And now we have a test that we can, it's a salivary diagnostic test where a patient will spit into a saline solution, and we send it to a company called Oral DNA, and they identify 11 pathogens that are associated, not causative agents, but associated with all of the aforementioned chronic diseases.
Right.
So somebody gets into a traumatic accident, to get back to that. So what does that mean? It depends, because a lot of times they get hit and their teeth are fractured and they need root canals or they need this or that, and we just did them. So I want to go on record of saying that, I don't like root canals, but I do send people who want to keep their teeth to a specialist that does that work. And it took me about 7 years to talk him into getting an ozone machine. So I had, at my office, I had maybe the two most well-known experts in dentistry, ozone in dentistry. And they came to the office, and I was like surprised by some of the things they were saying. One of the problems with the root canals, if I could digress a little bit, is that it's not just that what you see on an x-ray, the canal system, it's the tributaries that go out from those, and they can't really get them, so they can't get them disinfected.
Right, because those are miles long.
Mouse long.
Right.
Mouse long. And so the standard of care is to use bleach, sodium hypochlorite. That goes into those tributaries about 50 angstroms. So they've experimented in the Nova Southeastern School of Dental Medicine, did lasers. And so they would put a laser in there, and they would go about 1,050 angstroms. So better than the bleach, but not really enough. So the ozone people that came, Dr. Mulliken and Dr. Harris, explained to me that they did a study that when they infused it with ozone gas, because it's a gas, it was able to get in to those tributaries, and they would find the ozone in what we call the clavicular fluid, the fluid surrounding the tooth. They would find ozone there, so their supposition or hypothesis was that it went the whole way through into all those tributaries. So I do send people out for root canals, but I really want them to be sure that we have ozone when we're doing it.
So if you are, to those listening, if you are going to go that route, then you should know that there are, holistic, whatever you want to call it, these holistic-minded dentists or biological dentists that would have access or may have access to ozone, and that's the way to go.
Right, exactly. I mean, that if you want to keep the tooth.
Right.
Okay, it's because sometimes the better choice, and nobody wants to hear it, is take the tooth out.
That's right.
And so the other thing I want to mention is when you're having a tooth removed, the person that's removing the tooth must remove the periodontal ligament. And the periodontal ligament is part of the living tissue. You just don't take the tooth out and close it up. You have to scrape the bone to be sure all that DNA of that tooth is gone.
Mm-hmm. Deep work.
Yes.
We're talking deep work. So the person who's doing it, like you said before, they better know what they're doing, how they're doing it. Because
you could run into a problem. And honestly, Carrie, you may not. It just depends on your immune system at that time.
True.
And your genetic background. So
true. Yeah, I mean, that's something, too, when I talk about this with my mom, which we talk about health all the time. And, because we'll get there, too. Another topic is amalgams, and that she had a lot of those removed. Yeah. And while we talk with people in our life that we run into or people through our store, whoever it is, we often guard ourselves a little bit to say that, just because this happened to me and we had to, she had to remove 17 fillings, for her health, doesn't mean that everyone out there running around with amalgams needs to, run and do this necessarily, because some people, their constitution is stronger, they have a strong immune system, whatever it is, their genetic background, like you say, it's a different story perhaps for them.
Well, so I always tell this story. So you could make the case of a 94-year-old man. It's a mouth full of mercury fillings. He drinks a fifth of liquor a day and smokes 3 packs of cigarettes a day, and he's great.
Right.
And then there's the corollary where a 21-year-old girl goes in for a cavity and gets a mercury filling, and her life is devastated. Mm. So it just, and here's the, if I could interject here, because I know you want to talk about the mercury amalgam fillings. So taking the amalgam fillings out, the patient must be protected. Absolutely. And so how they're normally done, we use the International Academy of Oral Medicine and Toxicology protocol, which there's oxygen over the nose, a full face shield, a rubber dam, and a full body shield, and a high evacuation that sits right in over the mouth so that it can take the vapors as you're cutting it off, because you could say that it's actually maybe more dangerous taking them out if you're not protected than actually placing them.
Yes. Yeah, very important.
Right.
Yeah, that the dentist does it right and has a good reputation in that area of expertise.
Right, and that's one thing a holistic dentist should probably know exactly how to do, because that's one of the key issues.
Right, absolutely.
And it's interesting that mercury fillings are really banned in Europe and still not banned here.
That is interesting, isn't it?
Yeah.
Yeah. I mean, again, just a personal note, and I know we spoke about Root Cause, the movie Root Cause, which in 2018, when that movie came out, that documentary, I saw it right away, and my mom and I just, had our jaw on the floor, like, oh my God, this is like just exactly what happened with her in many, many cases. Yep. And what we we're so like ready to share it with everybody. And I remember I posted on Facebook, you guys got to see this. And I had someone pretty angry with me that I posted that documentary because turns out, it was a quote unquote friend, really an acquaintance, on Facebook. And turns out her father is a traditional dentist. Right. And so she was taking issue with this fact of, not in her mind, it's not a fact, that amalgams have any problem because the Dental Association, I guess, is just, they put their stamp of approval. It's A-okay. It's completely safe. But not my experience. And why would you get angry with me if I'm just sharing my experience?
Right. Well, I think that's, how when you do something all the time and that's what and you really don't grow, then you're going to say, hey, you're threatening my livelihood, and that's garbage, that's crap, that's, it's not true,
right?
Because the American Dental Association or the FDA or whatever said it's okay. Well, look at the amount of things that were okay and then they're not okay.
Right.
Okay, no matter what. So, you have to learn, and I think that's one of the things that and so I get the same thing. It's interesting because I have a lot of respect in the community with a lot of non-holistic, because my dentistry.
Sure.
Okay, and they will listen to me, and they may not believe it, but they'll listen because I'm not doing any harm. Actually, I'm doing protection that protects people, but I'm not doing any harm. I mean, does it matter that I put a rubber dam and oxygen on somebody? No, it's not going to hurt them. So, and I mean, that's kind of where I am.
Yeah.
It's just a journey, and I think the whole world, if people would just listen instead of talk.
Yes.
We would be better.
Right. Yeah, they say that whole thing about having 2 ears and 1 mouth for a reason.
Exactly.
Right.
Exactly.
Yeah. So on this topic then of mercury amalgam fillings, I'm sure there's someone out there listening to this either soon or later that has that philosophy of, well, I have lots of mercury fillings, whether they have health issues or not, who knows? But so to people who might not understand the dangers of that, could you speak to it a little bit of what's wrong with amalgams?
Well, I mean, it's the amalgams have 35 to 50% mercury. So no, if you today, if you were going and somebody didn't call it amalgam filling and they called it a mercury filling, you would say, wait a second. I mean, I remember as a child when we had mercury thermometers, I would play with that mercury and squeeze it and watch it, whatever. But today I wouldn't do that.
Right.
So there's no amount of mercury that is good for anybody. Mm-hmm. Even though, I think, now I'm just trying, I could be wrong about this. I'm trying to think who it was. I think he was a Russian czar that they exhumed his body. And he was so full of mercury because that's how they called it quicksilver. That's how they would try to get rid of chronic illnesses way back in the day.
Wow.
Okay? So it stays with you. And I had a holistic practitioner that told me, he said, that he had mercury fillings done and he had them taken out safely. He says, but mercury always stays with you. You have to detox it all the time, and that's another thing that we can spend just a few minutes on the detoxification. I don't do detoxification because other than minor stuff, because of my dental license. Mm-hmm. But there are practitioners who do that. So if any of your listeners are saying, "Hey, I want to detox and I have mercury fillings," you should have the mercury fillings out before you detox, because
important.
because the binders that are going to take that mercury out are going to go to the largest source of mercury, which would be the fillings. And it can take that mercury and bury it deeper in your soft tissues. So you should take that out before you do that. And find yourself somebody who does, and ask the questions like, what kind of detox are you going to do?
Right.
Okay, and understand what they're going to do.
Right. Very much so. Yeah. And this is why it's so important to have, if you're on a health journey, like a detox, that's a serious one with, mercury, for instance, to really have a guide that knows this path. It's walked the walk and done the,
right.
It's hard to find, but it's worth it, because you don't want to make some of the mistakes. Like you say, if you go detox route and you haven't taken the mercury out, you could be doing yourself a lot of harm.
And you could be getting sicker.
Yeah.
And then saying the detox is wrong. And it could be because we didn't take the mercury out. But the other thing is that your listeners, if they have an issue with that, they really need to get a heavy metals test and find out exactly what their burden is, and then have them have the physician who's going to take the mercury out and detox them, have them consult with their holistic dentist and say, how should we go?
Right. Right.
Do we want to take all the mercury out first? And usually, if you have somebody that is really sick and has a heavy mercury burden, you don't take them all out at one time.
Right.
You might take 2 or 3 or 4, a quadrant or something, and do this over a period of time, take it out, and then they can get their detox.
Absolutely. Like with my mom's story, she took 6 or 7 years to get her mercury fillings removed over a period of time. There was times where she'd go back to the dentist and they would say, we can't work on you right now. If we do, you'll die.
Yep.
So, it's that severe. So back to the fillings question, what should people be asking for or looking for? If, let's say, they're going to a traditional dentist, they've had this traditional dentist their whole life, they feel really comfortable with them. Now all of a sudden they're going to come in and say, I've got a filling. Well, I don't want amalgams. What do I want?
Right. So here's how I view this, is that because the mercury fillings themselves are not aesthetic, they're black or gray or silver or whatever. And so now everybody's using resins. So my thought process is, this is going to be very interesting, because now we're going to get rid of the mercury burden. Now, what about petrochemical poison that's in the resins? So what we did is we looked at all the resins, and we were looking for something that didn't have BPA in it. And I talked to the companies. My staff talked to the companies, and everybody said, oh, no, we don't have BPA. So we did our own research, and yes, they did. So we were able to find one company, I think it's Voco, that we use because it doesn't have any BPA in it.
Wow.
So, you don't know what questions to ask unless you ask somebody and try and get some information. And we can help with that.
Right. Yeah, it's so important to be your own health advocate and do the research yourself. And you guys took it to the next level. I wanted to also maybe back up a little bit about the microbiome, because I know, being a patient of yours, that you guys have some pretty cutting edge stuff and for equipment. And one of the things I remember doing a while back was where you can look at the different microbes in your mouth. Is that the test you were talking about earlier?
No, but that is, we use a phase contrast microscope, and we take a swipe on a patient that hadn't had their teeth cleaned first, and we put it under the phase contrast microscope, and you can see, you can see all the critters that you have. Now, some of those, like spirochetes, they look like spirochetes, and it's not specific that you can treat off of a phase contrast microscope, other than you can always get that every time you come in and see how they look. A more specific test is that I alluded to earlier, is the oral DNA, the salivary diagnostic test. They can tell you what the genus and species of all those critters are, pathogens.
Right. Yeah, that's
Okay.
pretty interesting because I remember seeing them on the slide and you're like, whoa.
Yeah, no, it scares you.
It does. And
Yeah.
it's kind of good because it scares you straight. It's like,
Right.
I better get on my dental health.
Right, exactly. Exactly.
You know, and I've had times where I've had an appointment and I feel like, I've been doing really good. I've been doing everything like they said, the flossing and of course brushing multiple times a day and then water picking. And I'll come in and I'll just be so confident and the dental appointment goes great. And then I've had times where maybe I was a little stressed out and maybe I ate a little bit too much sugar in those few months leading up to my dental appointment. And I can tell the difference between my appointments.
Well, I'm sure it's not as uncomfortable.
Right.
Because when you have inflammation, it gets a little bit more uncomfortable. But it's good, And speaking of that, if I could not digress it. So one of my lessons in this is that do you know, Carrie, how we came up with see your dentist twice a year?
I do not.
Well, that's interesting because I didn't either. So back in the 50s and 60s, Gardol, which was a toothpaste commercial, and it said see your dentist twice a year. So everybody thought that was a standard, see your dentist twice a year. Well, that's not really a standard because we've learned that it's better 3 or 4 times a year depending on what your condition is. Now, if you're good and perfect like you are, you don't need to do that all the time.
Yeah.
But some people that have beginning periodontal disease with increased gum pockets and bleeding and swelling, they need to be seen more than twice a year.
Right. Yes, for sure.
And so that's one way you can guarantee that you're going to do the very best that you can do with your oral health. Mm-hmm. And the human condition is interesting because we're flawed.
Very.
And distractions take us away from things. I get up in the morning and I got to get to work and I'm rushing and I don't spend as much time maybe as I should on my own mouth because I'm in a hurry.
Right.
And so you just got to take some time and just take a breath and say, I'm not going to die if I don't get there at that time.
That's right.
And just take care of yourself.
Yeah. When I had a long commute, I had a little mantra I said in my head, I get there when I get there.
Right.
That's
a good way of doing it.
Yeah. Because I had to kind of calm myself down. You can get caught up in the rat race.
You bet.
Yeah,
you bet.
For sure.
You bet.
Wow. Another thing you do at your office that's probably not common, to me it's special, I think, is the pockets. Like you just said, like checking for those, and they do the numbers, they calculate that. I would bet that many people listening to this don't have any idea what that is. Could you explain a little bit about what that is?
Sure. So, we were talking earlier about inflammation. And the dentist gets to see the inflammation probably more often than the cardiologist or the endocrinologist or whatever. So we see that. So the standard of care is that everybody should have we call it a periodontal charting. And I'll explain what that is. And that should be done at least every 13 months. So what we do is we have a probe and we probe around all the gum pockets, six sides of each tooth, and they get called out and charted, and we look for points of inflammation. So if you have a pocket that exceeds 3 millimeters, now that's not very much, but exceeds 3 millimeters, then there's bleeding, then there's a concern. Now, if it's 4 millimeters, you could say, well, that's manageable and you can keep that clean if you do this. But if you get 6, 7, 8 millimeters, then you have advanced periodontal disease and bone loss, and you need to see a specialist because you're probably going to have some gum surgery, laser surgery, or something like that.
Yikes.
Yeah. and the interesting part about this, Carrie, it's all controllable. Mm-hmm. We can control it.
We can prevent it.
Right, unless you have a genetic predisposition.
Yeah, it's a lot of just being vigilant and, getting on top of things. Now, that brings up a good point because I often say I think the body has the ability to heal itself and you can reverse things if you go down the wrong path and your body wants to heal if you give it the right tools. So do you feel like the mouth mimics that too? Like if someone's listening and they haven't been taking very good care of their teeth for a while, can they reverse it by getting more vigilant?
Yes. I mean, unless it has gone into the bone, absolutely. I mean, and that's the great part about that. I mean, sometimes we have patients, depending on what their age are. And they may have increased pockets but no bleeding. So they're in a much better position. But they know that if they fail to do what they're supposed to do, then they're going to be back with bleeding pockets again. And then the scenario is they'll have to see a gum specialist or a periodontist. Mm-hmm. Yes, I mean, it's reversible.
Right. Yeah.
And that's that's why it's really important early on to get your young kids and stuff in there when it's not threatening. I mean, don't wait till they have massive decay and they get afraid. Bring them in. Have the dentist, the hygienist, just clean them up, and so they're not afraid and they get an idea. Now they're not going to floss their teeth, and they're not going to do that, but the parents can help them and let them understand, because you can not only save a lot of trouble, but you can save a lot of money being very vigilant.
That's a good point. Yeah, I mean that's phrase about an ounce of prevention.
Yep.
It goes so far, and you do as a parent. I would imagine. I'm not a parent, so I can't say, but you role model. I mean, you can teach people a lot more by walking the walk than telling them what to do.
No, exactly, exactly.
Yeah. Okay. Well, I know I mentioned it before, and it was such an impactful film, and that is The Root Cause. You mentioned that wasn't something you've seen, but you have a book that you brought with you about this story. So just for those that haven't seen it, I would highly recommend going to YouTube and watching it. You can find the whole film there, The Root Cause, and it explains a lot about how much our mouth is connected to our overall body, our health. There's amazing stories in there, what's happened to people. But maybe since I'm not familiar with the book, you could tell me a little bit about that.
Well, I mean, this is basically Dr. Thomas Levy. He's written several books about mercury, and this is called The Roots of the Disease Connecting Dentistry and Medicine. So it's really, I mean, there's just a lot in here. But I would tell your listeners, if they're interested in reading and also seeing the movie, but also reading, this is a really good book to purchase.
Right. From what you recall from the book, can you give us any little tidbits about what's a big, impactful crux of the book?
Well, I mean, it's just so much, Carrie.
It's hard to boil down.
I mean, you can't really. I mean, it is what it's doing. It's making the connection between dentistry and medicine.
Yeah.
And chronic illnesses,
right?
And looking at some of the things like cavitations and root canals, and like he calls it, the roots of disease. And he also he goes into great detail about the tributaries, about the canal system, and what you can do with that.
Right. Yeah, I remember because I was watching it recently, part of the film, they talk about root canals, to bring it back to that a little bit, and how this practice it came about because of class and money. Mm-hmm. So back in the day, people would lose, have impact on their tooth. They might lose a tooth. They were worried that they would look poor if they didn't have a tooth.
Right.
So they came up with this practice of root canals to save the tooth, and they'd have a nice gold filling in there that they could brag about or whatever. Right. Made them look rich, and it was a class thing. I found that kind of interesting.
Yeah, that is very interesting, and I think it's not interesting, but true. Mm-hmm. So another story, just as part of my journey, when I was doing my residency, you're going to think this is just absolutely crazy. I mean, I would not do this today, but we did it. We had, I was in the Veterans Administration, so we had some old vets that would come in, and one guy was going to lose a tooth. And so they said, hey, let's extract the tooth out of the mouth, do a root canal on it, and reimplant it.
Ooh, wow.
I mean, today I'm thinking this is ridiculous. So that was before implants and all that kind of stuff was there. So somebody tried it. And I don't know the effect of that, because when I was gone in a year, I didn't know. But, I think that's almost ridiculous what we did.
Yeah.
Trying to do that, save the tooth.
At all costs. Yeah.
At all costs.
Yeah, and I can understand in the world that we live today why someone would want to save their tooth. Obviously, you're judged by your smile.
Right.
Looks are very important.
Yeah.
I get it. But when you've seen the suffering that can happen with infected, deeply infected area of your body. So for instance, another thing that's top of mind right now is is breast cancer, because I unfortunately know someone who I went to high school with who just passed away from breast cancer. It's just so sad. And, I have just wonder. It's just curiosity because of what I know about teeth and health. Could there have been an impact on a tooth that was related to that because of the meridian system? Is that something that you can speak to?
Yeah. So we have a chart. It's a meridian chart. It's a Chinese medicine, and every tooth has an organ or system that it's associated with. So if somebody is considering something and they have some chronic illnesses, we'll look at that chart and say, no, wait, this particular tooth is associated with the bladder, or it's associated with the intestines, or associated with the heart. So we can look at that and say, hey, look, you have a failing root canal on that tooth, and so here's your options. And, because we can't guarantee that you take it out and that gets better, because there could be a lot of different issues with that. But if it's a situation where you have a propensity for that, you probably should take the tooth out.
Yeah.
And I know that that's not comfortable. What if for example, let me give you this example. So there's a naturopath and a physician that's out in the West Coast. His name is Dietrich Klinghardt.
Yes, Dr. Klinghardt.
Dr. Klinghardt. And so if you have cancer, he wants all the root canal teeth out before he treats you. He doesn't care where they are. And I had a patient come in, and she had 4 front teeth, crowns on them, and she had root canals on them. And she said, Dr. Klinghardt wants these out, but I just can't do that.
Because they're her front teeth, right?
Her front teeth.
Wow.
And so, I told her, like we're talking now, I told her, I said, well, look, I said, you can always get those replaced and do whatever, but I don't want to lose my front teeth. She passed away.
Oh, heartbreaking.
Yeah, it's heartbreaking, but, you can't, people have their attachment to that, and she just didn't want to live her life without her front teeth.
Right. So she could have removed all of those,
right,
and had some kind of apparatus.
Some kind of either a long bridge or in today's world, implants.
Yeah. Yeah, implants. So, that brings me to another thought. Just curious. Sure. How do you know what type of implant? I know nothing about implants, obviously.
Well, good. We're going to learn.
Yeah. Well, that's great. How would someone go about picking the right implant for themselves?
So they're right. It's very complicated.
Yeah.
So titanium implants are really the standard of care. Okay. Now, and there are some recent literature about the ions on the titanium that they're finding in different parts of the body. But that could also be for hips and knees, because they're out of titanium. Mm-hmm. So dentistry has come up with also another option, and my holistic patients would prefer to have zirconia implants, because they're not considered metal, even though they're very close on the periodic table of elements. And the problem with the zirconia implants is sometimes they're not as restorative friendly, because they haven't made that leap yet where you can get a custom, we call it an abutment, that looks like a prepared tooth. It's the same diameter and so forth. You can do that with titanium, but you can't do it yet with this. And I've talked to the manufacturers about that, and why can't we get here, because it makes no sense. And it'll be here, but it's not here yet. Now, there's a new system. It's called SDS that looks very favorable. It's a Swiss Dental Solutions, and it looks very favorable, and it is, you can treat that implant like a tooth. Like you can prepare it like you'd have to with a tooth.
Interesting.
So there's a lot of stuff that we're still caught in this time warp where it's not really here. But if you have somebody that is does not want metal, and that's the case for a lot of people, then we do have an option of zirconia. We just have to accept that maybe the aesthetic result will be fine, but it won't maybe as good as we could do with a titanium.
Interesting. Have you heard anything, and I haven't heard much about this, but I've seen headlines here and there about regrowing teeth?
Yeah.
How far away are we from that?
Well, I mean, the Japanese, in my understanding, and so if I'm in error here, please forgive me, but they've been working on that for a long time, almost for 40 years. And so we don't have any of that yet. But I believe that day will be coming. But when you think about that, you've got to get you've got to grow a tooth bud, and then you got to put it in the right place. So it's a little more complicated. But, with the way the world is with AI and all that stuff, I mean.
Digital printing.
Yeah, absolutely.
Yeah.
So who knows?
Yeah.
But it's not here yet. But how wonderful would that be?
That would be amazing.
Right.
Yeah, because you think about, when you lose your teeth, then you're also losing bone, right? And then there's deterioration, unfortunately, that's happening that can impact bigger things down the line.
Yep. And so if for your listeners, when a tooth is removed and nothing is done, like a bone graft or anything in that area, then it becomes almost like a knife-like ridge rather than a round ridge where an implant could be placed. So if you're considering an implant, and then that's another thing with bone grafts, you got to check what they're using with bone grafts. Is it Mr. Saturday Night that died is in a morgue and has a cadaver bone? How do you know what you're getting? Right. So you got to ask those questions. And sometimes what they're doing now is they're using your own bone, and they're using a plasma-rich protein or plasma-rich fibrin that's yours. And mixed together with your bone and using it as a bone graft. So that to me would be the ideal situation.
Wow. Bone graft, just the phrase alone is pretty scary and intimidating for me. Put my mind around. But yeah, I mean, some people are in that situation for sure. A lot of people probably. So one of the questions I had in mind was to ask you, and maybe it's kind of basic, but maybe you have a deeper, level of a tip that you can offer than I can even imagine. But obviously behind brushing and flossing and water picking, what do people really need to know about keeping their mouth in optimal condition?
Well, I mean, there's a lot of things. I mean, those are the essentials, right? And I'm going to the dentist on a periodic basis. It sounds like I'm being overly dramatic here, but that the hygiene appointment is very important, okay? And just don't brush it off as, I'll get them next month or something. You should just keep your appointment. I'm not talking about that I'm trying to worry about having people in my chair. I'm concerned about them.
Right.
Okay? That is absolutely. And then there's other things like oral prebiotics and probiotics that you can take that mitigate some of that. And I mean, it's just an overall, I think you have to care.
Yeah.
I mean, I think that's the individual responsibility that you have to care. And then your dentist has to do his job or her job. Okay?
Yeah, that's true.
So, I mean, using irrigators, you mentioned that,
yes,
right?
Yeah, I call them water pick. It's irrigators, another word, right?
So the thing with those, using water in an irrigator is almost valueless. Yeah. So you actually need to get some natural medicament that you can put in there that's going to help decrease the biome.
Oh, is that what I'm using from you guys? The little
Perioscript.
Perioscript.
Yeah.
Okay, so you put that in the water.
In the water.
And then use it.
Then you use it because using the water itself is
useless.
It's useless.
Oh, interesting. Okay.
I mean, I guess it's not useless, but yes.
It's just not doing what it could be doing. It's
not doing what it could be doing.
Yeah. So for reference, Perioscript, you got to get it from your dentist, I think, right?
Yes.
Yeah.
I think you can get it online.
Oh, okay.
You have
probably.
to check.
Yeah,
you
probably in today's day and age, you probably could.
I'm sure you can.
Perioscript is what I use. Yeah, I get it from Dr. Light's office, which is great. That's awesome. So see your dentist. Don't let go of those appointments. Get vigilant if you haven't been vigilant. Now that brings me to another point, and that is like holistic dentistry. There's in my experience, I don't know how many there really are, and how would you find one if you're somewhere not here locally? How would you find a good biological or holistic dentist?
Yeah, that's a really good question, because there's more and more of them. The dentists are young dentists are looking at this and they're saying, maybe there's something a little bit more I can be doing, and on and on. So the International Academy of Oral Medicine and Toxicology is a group I belong to. It's a fascinating group. They would have a list of IOAMT members.
IOAMT.
International Academy of Oral Medicine and Toxicology. Okay. They would have a list of people in areas. And I would caution everybody on that, because just because you're a member of an organization doesn't mean you get it. Mm-hmm. You could just have that name only, but you can research them. Right. And that gives you another. And also there is a holistic dental society. You can look at those and ask for references and go on their websites.
True. And
with the International Academy of Oral Medicine, they have position papers on fluoride, on mercury, that public can actually go and read. Mm-hmm. Yeah. So it increases your knowledge.
Increases your knowledge, and that's the whole thing with this podcast, is that trying to help people that might be really busy and give them some insight into things they might never have heard of before.
Correct.
And to really advocate for that. We all have to be our own health advocate. We all have to dig in and just not take the word of it from someone else.
Right. And like in your case, sometimes the patient who has the affliction needs an advocate.
Right.
Because sometimes they don't know the questions to answer, and they need somebody else that's going to fight for them. Yes. Even if it's in a chronic illness and you go to the hospital, you need to have an advocate.
So true. Yes, and in that note, I think in preparation for this, one of the websites I ran across was, here's some questions to ask your dentist to see if they're on the right page. So I'm going to go back and find that for listeners and, put those questions in the show notes so anyone who's listening to this later can check it out.
That's great.
And maybe that'll be a helpful tool for somebody. Let's see, what else did I want to talk to you about, Dr. Light? Is there anything that's top of mind for you that you want to share?
Oh golly, I'm like talked out. No, I'm just kidding. So one topic we didn't talk about that I want to make people aware of is cavitations.
Okay, cavitations.
So cavitations are like ill healing bone. So they're usually found in third molar sites or sites of previous root canals or something. So they had been called nicolesions, and what happens is it's a bone that doesn't heal, and so it remains soft. And so there are people who purport that while they've gotten they've gotten their mercury out, they got this stuff, they're still not right. And so they go back into these sites and they look at them. And so what we use is this company is called Behm readers. So a CBCT scan, which is a three-dimensional
that's the cone scan, right?
Yeah, the cone cone beam.
You have the cone beam.
We don't have it, but we have one that comes to us, and we send it out. I usually send them out to a specialist because I want them to read it.
That is like top of the line X-ray that you need to get if you have any kind of serious oral problem.
I think so. We use those for somebody has an infection, just like for an abscess on a tooth. Because it's a three-dimensional. What we have, we use digital X-rays, but they're two-dimensional. They give us a hint, but they don't tell us exactly. Sometimes those things you can miss pathology. So we get them. Anytime we have a question, we get those. But if you're having some chronic illnesses and you're concerned about cavitations, get a CBCT scan and then have your dentist send it to a radiologist. And we use Behm readers. There's others out there. And they will read that. And, the interesting part about this is that we had the hardest time for them to read it when we used the word cavitations. It's like they were told that they can't diagnose cavitations.
Interesting.
So we changed it to healing bone.
So just so people understand, cavitations are exactly what? Is that a cavity or a hole in your mouth?
It's a hole that's filled with soft material.
Okay.
Okay. And people say that this can cause chronic illnesses, like, not so much cancer, but just weird diseases that nobody can find an answer for.
Gotcha.
So this is changing too, because a lot of times when I first learned about cavitations and people were doing what they have to do is they got to dig into the bone and clean out the bone, and if there's teeth associated with it, they take the teeth out. So sometimes when they would do this, the people were orally debilitated, and I was very uncomfortable with that. But and did it help? I don't know. But so I have a guy that I work with that's an osteopath. So what he does, instead of doing that surgery, he uses PRP that I talked about before, and he goes in with ozone into the bone.
Wow.
And he says he can cure the cavitations that way. Not that the jury's still out, but it's a least invasive way to address that.
Wow. Go in with ozone.
Yeah.
Yeah. That's wild.
Yeah. And replenish that area with your own bone and your own blood.
Interesting. Well, they do say, lack of oxygen
Right.
is a big problem. Whether it's in your mouth we're talking about now or somewhere else,
Yep.
That's why the deep breathing
Yep.
and just the movement and circulation and all that stuff leads to optimal health. And then the absence of it, the opposite.
Yeah.
Yeah. Wow. Interesting. There's so much more to be said.
Well, there is, Carrie, and because, the world turns. So every day there's a new thought.
Yeah.
Okay? And sometimes the thought gets disproven, and sometimes everybody wakes up and says, oh, my God, that's right. He's right.
Yeah.
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 And so my philosophy is just don't do harm.
That's right.
Do what you can do that can enhance the outcome of what you do.
Yeah. To enable healing.
Enable healing.
Yeah.
Enable the body to heal itself.
Enable the body to heal itself. Yeah. That's the biggest theme here. Wow. Well, how can people find you if they were more curious to reach out to you?
You have to look under a couple rocks. No, I'm just kidding. So they can. I'm in Lake Worth, Florida, on Congress Avenue. You can call the office. It's 561-965-9345. And my staff is very knowledgeable. If you have questions.
And wonderful, by the way.
Thank you. I think they are too.
Yeah.
Are they going to see this podcast? Because I had to say that. No, I'm just kidding. So they are wonderful.
They are.
So that they will help you and answer questions. And even if you're, so my patient base is not just from this area. I have people coming from Latin America and Europe and Canada. And I have a lot of different patients. So, and we'll try to find somebody that's close to you and give you a reference. But I don't know sometimes if we give you names, what they are in their office or what they're doing. So you have to see for yourself. And if you have a problem, you can just call my office. You
can still dig in. You still have to own that responsibility of finding out and asking questions and getting knowledgeable, but you can at least help point them in the right direction.
Yep.
That's great. Well, I'm sure we could have a whole other conversation here, Dr. Life.
Maybe we will.
Maybe we'll.
We'll see how successful this is.
I love it. So I, again, just want to say, thank you so much for taking time out of your day to talk to me about this very important topic regarding health. And for anyone else listening, I just like to say, stay healthy so you can stay happy. And I'll see you on the next one.
Thank you, Carrie.
Psst, can you do me a favor? Text the link to this episode to a friend who you know needs to hear this. By doing so, you are helping me with my mission to open minds to all the holistic health solutions that are available to us all. We hope you'll support our small business and shop ngvitamins.com for all your supplement needs. Oh, and don't forget to follow, hit the bell on your platform of choice so you never miss an episode. If you enjoyed this show, please consider sharing your review on iTunes. Until next time.